The hip hinge is a very versatile motion because it will reduce the amount of strain on your lower back, particularly in the discs, allow you to flex forward at your hip rather than in your lower back. So whether you've suffered from low back pain for a number of years, or you have degeneration, arthritis, sciatica, or whether you have a fresh low back injury, learning how to do this particular motion is going to save your low back in the long run. In this video, I'll explain to you how to do the hip hinge properly and different exercise based on the hip hinge. If you remember these two little tricks, doing a hip hinge is going to be pretty easy. And you're going to be thinking to yourself, should this be harder? No, keep it simple. Two things, two little tricks. The first trick, pretend that you have a cylinder for a rib cage and a cylinder for a pelvis, okay? You want to stack those two cylinders on top of one another and you don't want them to bend and flex. That's the first trick. And when actually doing the hip hinge, once you're in position, you're going to flex at your hip and you're going to close a drawer with your butt. Kind of a little mental trick to kind of help you remember it. So you're stacked on top of one another, one cylinder, second cylinder, close the drawer with your butt. Once you master that motion, you can start to implement that in squats. You can start to do negative sitting into a chair. If you do this properly, you're not going to feel any pressure in your lower back. This is really safe to do after, like I said, like after that acute injury, or if you've had chronic low back pain for a long period of time. This is going to really help to save your low back. Till next time, we'll see you later.